Okay, sorry about
Okay.
that. Okay, now we're recording. This session is being recorded. Will be shared in the next couple of days in the Hoarding Connection playlist on the Benjamin Rose YouTube channel. I will be sharing a link with that in the follow-up email. Also in the follow-up email following today's session, probably tomorrow morning, you will be receiving an email with a link to an evaluation form. If you're applying for continuing education credit, you are required to complete the evaluation form to receive your certificate. Others in attendance who will not be getting CEs are still welcome to and encouraged to provide feedback because it helps us improve future programs. There's a lot of material to cover today, so we will be holding all questions until the end, after each of the panelists has had a chance to speak a bit. However, you can enter questions at any time during the presentation in the chat box at the bottom of your screen. And I'll turn it over to Regina to go through some housekeeping.
Yes, again, welcome, and thank you all for participating. So I'm Regina Spicer from the ADAMHS board. I'm a training officer there. My counterpart who is on board here is Carmen Gandarella, who will also be assisting in monitoring this training. It is very important that if you are using your video, have capability, that you change your name from letters, phone numbers, acronyms, agencies, and put your first and last name. That is for accountability for insurance, attendance purposes, as well as CEUs and RCHs for our respective boards in Ohio. We will be issuing certificates and CEUs after the holidays to those of you who provided your license number to us. If you're licensed by the state of Ohio, we will input your CEU credits into CE Broker for you. You will also get a certificate with the respective CEUs for your records. Those of you who are out of state, you will receive the certificate with the CEUs and then forward it for approval to your respective boards. It's important that you stay for the whole 2 hours in order to get the credit. If you have to leave, then your credit will be adjusted for the time that you spent in the training. Please utilize the chat box for your questions and comments. Toward the end, Larry will be referencing your questions and comments from the chat box. So other than that, I'm not sure if Jean said it or not, but by tomorrow morning, if not by end of day, you will receive a link for a survey. In order to get the CEUs, you must return the survey. Please include your name on the survey because it will be difficult for us to match the survey without a name. If you did not get your license number to us, please forward that your license number to us so that we can add it to our spreadsheet and get you your appropriate credit. Okay, so without further ado, I do turn it over to Jean.
Okay, thanks, Regina. And I'm going to introduce the moderator for today's discussion, who will then be introducing our panelists. Larry Vavro is the Chief of Adult Protective Services for Cuyahoga County. He is a licensed social worker with an AB in Social and Behavioral Sciences. He has been part of the local Domestic Violence Fatality Review Committee, is a founding member of the Hoarding Connection of Cuyahoga County, and serves on the Elder Abuse Domestic Violence Roundtable. He has a history of working with patients with mental illness whose treatment has followed a psychosocial rehabilitation model. And he was an active participant in Project Assist, that's the SAMHSA grant funded cooperative that ultimately led to the creation of the Hoarding Connection. Also in his career, he has provided services to populations with developmental disabilities, and has case managed teen parents to help them complete their high school education. And now I'll turn it over to Larry for hoarding and the pandemic.
Well, thank you, Jean. So hoarding and the pandemic is our topic of discussion here on day 3 of our Hoarding Connection Conference. We have the privilege of having 6 panelists representing different professionals who, across their professions and the services they provide, they deal with those people who have hoarding difficulties and hoarding behaviors. We have representatives today from Adult Protective Services. I'm giving that opportunity to my boss to handle that. Some person representing Millennial Housing. We have 2 representatives from Benjamin Rose Institute on Aging surrounding case management and day treatment programs, as well as we have a representative from the Cleveland Fire Department and the Cleveland EMT. So we have a wide range of people who deal with those patients and clients that we all run across who have those hoarding behaviors. So throughout the presentations, or for their presentations, I've asked them to address 3 separate areas. Okay, the general services that they do offer from their agencies and their professions, how work has changed since March, since the pandemic occurred and started affecting us, as well as how persons with hoarding behaviors are being helped in relation to the COVID-19 directives, okay? It's already been said twice, but I am going to repeat again. Please hold off questions till the end, but please, if you do have a question or something pops up and you're curious about something and want further clarification, please use the chat room function down on the bottom of your screen and enter it in, and I'll reference that later on when it comes time for question and answers at the end. So without further ado, I get to introduce our first presenter. First presenter on the panel is Natasha Pietrocola. Natasha has spent over 17 years in social services addressing diverse issues in the field of aging, including community-based long-term care, elder abuse, and social advocacy. Natasha has been a dedicated professional and advocate in raising community awareness about the challenges serving elder abuse victims. She currently serves as board member and chair of the Consortium Against Adult Abuse, and is a board member and board immediate past chair for the Ohio Coalition for Adult Protective Services. Both coalitions have been strong supporters in promoting services to protect vulnerable older adults through the state of Ohio. Natasha currently serves as Deputy Administrator of Community Programs and Services, Cuyahoga County's Division of Senior and Adult Services. In her current position as Deputy Administrator, she has the executive oversight over the APS and manages all the reports and investigations of allegations of abuse, neglect, self-neglect, and/or exploitation of impaired elderly residents 60 years of age who reside in the community, as well as vulnerable adults 18 to 59 years of age. She's also responsible for oversight with the agency's centralized intake unit and the Information Services Program, which is an aging and disability resource center. Natasha is also the facilitator of the Cuyahoga County Adult Protective Services Collaborative, sometimes known as the I-Team. She holds a Master's of Business Administration from Cleveland State University, a Master's of Education in Community Counseling from the University of Toledo, and a Bachelor of Arts in Psychology from the University of Toledo. Natasha also completed the Fundamentals of Gerontology courses with the University of Southern California's Davis School of Gerontology. So now, I introduce to you Natasha Pietrocola.
Thank you, Larry, and thank you everyone who requested me to be a part of this panel today. Like Larry had mentioned, there were 3 questions specific to today that they were looking to have answered from all us panelists. And I'm going to begin a little bit about telling those of you who are not familiar with Adult Protective Services what Adult Protective Services means here in the state of Ohio, and specifically here in Cuyahoga County. As Larry mentioned, Larry and I work very closely together. Larry is the chief supervisor over APS, and that is a program where we have 25 full-time social service workers who investigate allegations of abuse, neglect, exploitation, and self-neglect. Now, since we're talking about hoarding today, obviously hoarding can fall into one of those categories, and most likely it comes into us as a self-neglect case. The state mandate is the same throughout all of Ohio. So all 88 counties are to adhere to some of the same criteria about what constitutes an adult protective services case. I'm going to just go over very briefly, and not to be insulting, because I see a lot of familiar faces and names, and I know that we've interacted as professionals in the past, but I just want to give a quick review of what we do, and it all makes sense as we go ahead and continue to talk about hoarding today. In the state of Ohio, the mandate states that we investigate allegations that come in for those individuals who are 60 or older, who reside in the community. APS is one of three, Ohio is one of three states currently that does not have jurisdiction to enter nursing homes to conduct investigations. That's left to other parties in the state. But currently we are not able to go into nursing home settings, but we can go in any communal setting that's not a licensed facility. So we go in senior high rises, apartment, buildings that are just general apartment buildings, individual homes. We've been to, mobile homes. So anyone who's actually residing in the community, we ask that when a report comes in, there is criteria that there must be an allegation. And I always stress that the allegation does not have to be proven by the person who's the referent, but there has to be a suspicion that either abuse, neglect, exploitation, or self-neglect is occurring. We have multiple cases that come in with more than one allegation, so it's not something that is an unknown for APS to deal with some severe cases of older adults in the community. The other component that's important is there must be some type of impairment. And when we talk about impairment, that impairment can be either a functional one, so there's actually a physical limitation, or there's an actual physical diagnosis that someone may have. Somebody is arthritic, they have issues with ambulation due to severe arthritis, they have COPD, a chronic condition such as diabetes or renal failure, or they can have a cognitive impairment. So again, this is not something that we're asking the person who's referring the case to prove unequivocally is occurring, but just basically that they have some concerns about what they're seeing about that person's cognition. We have people who've come in with traumatic brain injuries. We've had people that are dual diagnosed, that they have substance abuse issues and mental health concerns. And we, of course, have people that, due to some of the infirmities of aging, have actually started to experiencing some cognitive decline due to a form of dementia. So those are the general criteria that constitutes an adult protective service case. So for any of those of you on this panel or on this call today that aren't familiar with making a report to APS, those are some of the typical questions you're going to be asked when you call our intake line. All of our calls are handled through a central intake. The central intake number is 216-420-6700. And bottom line is, when those calls come in, we have 8 social service workers who triage those calls to various programs here at DSAS. Now, hoarding more than typically would fall into an adult protective services criteria. Again, oftentimes when we look at hoarding, they come in as somebody who's self-neglecting. It could be a call from somebody who is a provider that comes into the home, and because of the hoarding situation is unable to continue to provide services because it's too much of a threat or a danger to that particular agency, an individual or medical provider, home health aide. It could be somebody where they're a first responder and it's an EMT coming due to a medical or acute issue, and they end up in the home and they witness some things that are of great concern. We've had referrals from neighbors, other family members, where there are concerns about the older adult who's residing in certain types of conditions. So once intake gets the call, they assign it to the appropriate program here at DSAS, and then, like I said, more than likely, a lot of those hoarding calls do fall into our Adult Protective Services program. Now, many of you might be wondering that because of COVID, have we really changed our practices here about how we deal with this vulnerable population? And the answer to that is no. It is a state mandated program. There are laws that we have to follow. And so because of COVID, the only thing that really has changed is that we're a little bit more cautious with going out on our initial visits and doing our investigation. But every case that comes to Adult Protective Services with an allegation requires a face-to-face visit to begin that investigation. And that has been made very clear by the state that we are not to deviate from that practice. So my workers will continue to go out. We go unannounced to the individual's home that we've been assigned to look into. And we begin our investigation at that point in time. We take into a lot of factors about what may be happening with the older adult. We look at medical conditions again. We at times have to go back to the referral source and talk to the person who reported the case to see if there's additional facts or any circumstances they would like to share with Adult Protective Services. We always welcome into our new case reporting system, which is called ODAPS, the Ohio Database for Adult Protective Services. If we have multiple referrals, that's a good tracking measure that's now been put into place. That's statewide. We can look up cases that might be known to other counties in the past. So it has helped us kind of rein in anybody who may be going from county to county, avoiding consequences if they're perpetrators or depending on what the situation may be. So that's kind of the gist of what continues to happen here at Division of Senior and Adult Service, and particularly into the Adult Protective Services program. Again, COVID has really only limited us with some of our other programs, but APS workers are still going into the home. And because they go into the home, we firsthand get to see if there are hoarding circumstances to that particular individual's lifestyle. We do work closely with city health departments and housing departments because, as you know, hoarding creates a whole bunch of layers of different issues. It's not just sometimes what immediately is seen, but there are also a lot of underlying supports that we try to utilize in order to see how we could best serve that individual and maybe address some of the problems that have been reported to us in APS. We are continuing to do court hearings. The probate court is currently not seeing in-court individuals, but we are doing that via Zoom. And quite honestly, our probate court has been really wonderful and not skipping a beat in that aspect. Our protective service order hearings are continuing as they need to be. Our guardianship hearings continue to be seen in a timely fashion. There were a little bit of kinks in the very beginning because we were all trying to adjust about how this new norm would look for us all. Those were very early on, but I think we've really come to a point now that we've mastered it. And so with just a little bit of background and limitations as far as time, I want to talk specifically about APS and hoarding. One of the concerns that we've been verbalizing in some of our areas and our meetings that we've had with other APS providers here at our agency is that social isolation has created a lot of issues with, I think, reporting. And I would be amiss if I didn't say that I feel that a lot of stuff is not being seen only because there's been changes made with people coming into other adults' homes. I think that a lot of service providers have kind of stepped back and they're not providing as frequent services as they once have. So we do get a little nervous about some of the cases we may be missing. We know that in general, APS cases are underreported. You know, that famous ratio of 1 out of 10 cases are actually ever brought to Adult Protective Services still holds true. And so if anything, I think the pandemic has created this kind of culture where the social isolation is occurring and we may not be seeing these hoarding cases as frequently as we should be. It doesn't mean that we're not walking into them with other allegations. But I think that it'll be interesting to see as this pandemic progresses and as things hopefully get better with vaccines and with just testing, that we may have an influx of cases coming into us. What we do find with a lot of our hoarding cases is two extremes. So we have those hoarding cases where we definitely go in and there are glaring issues where somebody definitely has some cognitive impairments or has some very severe physical limitations. And those are kind of easier to deal with because there's actually something concrete that you can base some of your care plans on. The ones that are tricky for us are those cases where we have a functioning adult who has every bearing about them. There are no cognitive issues, and there's been even cases where we've asked and requested, medical experts to weigh in on somebody's cognitive state and their ability to make certain decisions. And we find that those people are doing extremely well. We've had a few cases in APS. We had one a few years back who was actually a nurse, and this nurse was actively working as a nurse. She was in her early 60s, and her only concern was this hoarding behavior. And so it had gotten so bad that she was hoarding in her car, and she had a tarp outside of her home where she continued to take everything that was spilling out of her house, and then she was storing it in her backyard. And obviously, here is a medical professional, a very intelligent woman who had a very, successful career for all intents and purposes. But she had a mental illness that she was really struggling to, deal with. And it was something that was very hard for APS because we had no grounds other than the fact she met a criteria for an allegation and she met an age kind of criteria. But other than that, we tried very hard to get her to agree to receive some counseling and get some help. Another woman we had as well was a teacher, and she was substituting. She had retired from teaching, but was a substitute teacher, and her home was filled with books and notebooks and years of things that she accumulated as a teacher. And, there was, I remember the social worker coming from that home and saying she didn't realize there was even a staircase when she entered the front door. So what we're seeing is, like I said, often extremes about where people lie on the spectrum of hoarding. And, those that have the capacity, it's sometimes very difficult to get them to agree to services. And that's where we get stuck, where I think a lot of professionals get stuck. When people are making really poor decisions, but have that ability executively to make those decisions, it's just that they're not treating at this point in time what it really is, their mental health that requires some help. I'm gonna turn it on to the next panelist. I know that we were given a time frame, and I just want to stay consistent to that so everybody has a chance to speak and that we get questions later on in the presentation.
Well, thank you, Natasha. That was very thorough, and I appreciate your comments and examples about the hoarding cases that we've dealt with. Our next panelist is, let me jump here. Our next panelist is Darnell Brewer. Darnell Brewer has been working in the field of service coordination for over 10 years. He is currently a resident services coordinator for Lorexis and Alexia Manor with Millenia Housing. He completed undergraduate studies at Cleveland State University and received a Bachelor of Arts in Urban Studies with a concentration in nonprofit management with a minor in communications. He currently is completing a Master's of Legal Studies at the Cleveland Marshall College of Law. Darnell is trained as a community health worker through the Cleveland State University School of Nursing. He is also completing certification in professional service coordination, a PSC. Darnell is the founder of Senior Focus 216, which is a site and organization dedicated to empowering caregivers, kinship caregivers, and older adults to advocate for changes in legislation as it relates to aging, kinship, and senior issues. He is a national board member of the National Association of Community Health Workers. So let me do this because Darnell, oh, that didn't work. Hold on.
If you don't get the slide, don't worry about it. I can still call.
No, I accidentally kicked back something. There we go. No, I'll be able to share it. Here we go. Gotcha, Darnell.
All right.
So without further ado, here's Darnell.
Good afternoon, everyone. Thank you for allowing me to be part of this presentation. Before we go on, I just want to read a quote from Maya Angelou. I learned that you shouldn't go through life without a catcher's mitt on both hands. You need to be able to throw something back. And I just want to commend all of you who are on the call today for all your service, being essential workers and frontline workers and working in the age of the pandemic, and especially hoarding and all the other pandemic issues that we're working with. You go to the next slide. Change, because we already went through the what's it about me. One of the things, as a resident service coordinator, you go through that because you already did that before. So thank you for the introduction. Thank you. A lot of things have changed since the pandemic has come abreast. I worked as a social service coordinator, like you said, for Lorexis and Alexia apartment. Lorexis is a senior and or disabled building with 5 floors, and Alexia is a senior building with 62 and older. So I have a mixed population. And one of the roles as a resident service coordinator is to make sure our residents age in place. We're in various buildings throughout Cuyahoga County, across the nation. There is also a national organization called the National Association of ADAMHS, American Association of Service Coordinators. And I also can look at this through the lens of as a community health worker. So I can look at it from 2 different perspectives. One of the things that have changed, and I'll piggyback on something Natasha said, is with social isolation and so many things going on and so many changes in the rules and regulations when it comes to property management, is one, monthly inspection. That was one of the main goals of our monthly inspections when we went with the manager to each individual apartment to do sort of just a little safety check, a maintenance check. And as they go through his apartment, they would come back and tell me as a service coordinator, then I can reach out to people like APS or reach out to the social service agency to let them know that hoarding may be an issue. So with the change in the precautions and the way that we access these apartments, there is some hoarding that may have not and has not been seen. With the social isolation, the support of family and friends have also changed. We have family who do not come visit other family due to COVID, or friends who do not visit friends due to the COVID and safety precautions. So those were our lifelines when it came to hoarding, when we knew when something was going on. These friends and families would come to me, the management, or also someone else, APS, and make us abreast of these issues. So that has been a common theme across this pandemic, all the social isolation and also the precautions that many of the family, friends, and also the social service agencies are taking as well. They are coming in, but they're taking so many precautions. Maybe there are some that only step at the front door. In terms of hoarding, they can kind of hide some of the things that are behind the doors, or they may not come at all. They do the phone check. So they do the phone check, and on the phone they say, well, everything's okay, but we know that there is a hoarding issue going on. So just those top 3 things: the monthly inspections, support from the family and friends, the response of the agencies has created a pandemic amongst itself. And I just know when this pandemic is over, like Natasha said, we're going to have a bunch of cases come through where we're going to see a lot of hoarding issues come about. And that leads to number 4, increase in misunderstanding of the hoarding disorder. When this pandemic is over, we're going to see a lot of these cases, and hopefully with this conference, in a way that we all go out and educate others, we can decrease that misunderstanding of hoarding and the disorder. The last thing is pandemic shopping. A lot of our residents now, they used to go out, but now they have the mailing and the boxes coming in. So we know with social isolation, and especially with seniors who want to stay in their home, they don't want to go out, they're listening to the news, they can't access the things outside, so they're hoard shopping when it comes online. Not only if they're hoard shopping, but also if they do have someone who's in the building because of the pandemic. And I'll just give you a perfect example. We had a young lady who was in our building, and due to lack of tissue, as they per se, she paid $20 for a roll of tissue from someone in our building. Yes, she was a hoarder. Yes, she had a lot going on, but the hoarding issue, the pandemic issue, the mistrust of the system, and what's going on, social isolation, all played a part of that, where now we have people who are paying exorbitant amount of prices for certain things that may have cost something else. So that's something else we need to look out to when it comes to the pandemic and how things have changed. And you go to the next slide. I'll just go through a quick scenario. We had a young lady named Ms. ZZ, and the names have been changed, who was a hoarder. And she came from a single family home to a 1-bedroom apartment in our Alexia apartment. Her eldest daughter lived in Akron. With this move, she was clearly in down mood because she's coming from a large home to a small home. And it kind of just changed her whole attitude when she was more in a depressed mode. She was already a hoarder at the old house, which was unaddressed. So when she came to the smaller apartment, we knew that small apartment became a big issue. It became such an issue that she was ordering so much stuff. Also, with the group of people that were volunteering in our building, bringing in food packages, she hoarded up food packages on and on. Not only did she hoard with herself, but she also cooked with another young lady in our building. So when things were coming in and packages were coming in, she would pass it on to another young lady in our building, and it just became a big old issue. After sneaking a peek into her apartment, because we had an EMS call, we kind of addressed the issue when she came back. And that's another thing that have changed when it comes to the pandemic, when it comes to the relationship with our seniors, technology. One of the things we had to do was get her underlying issues addressed, which was her mental health, which was her health in general, and also the connection to family and friends, and also her daughter. So what we did was we did telemedicine with some of the psychiatrists in the area. We did telemedicine with one of the doctors. We did hoarding with her daughter who was in Akron. But the problem with that is the access to technology. So as we go through the pandemic and we have this social isolation with our residents who are hoarding, who needs the underlying issues addressed, we now have to find a way to get those issues addressed and finding that technology and learning them how to teach that technology, learning them how to access that technology, having Wi-Fi in their apartment, or having just that phone to reach out to someone. Because a lot of our seniors only have that Obama phone, what they call Obama phone, or that minute phone. So those minutes can go away very, very quickly. Not only that, we tried to get her involved in crafts. So once we got involved in crafts, that became another hoarding issue because she started to hoard craft issues. She started to hoard books, things of that nature. So we finally got to the goal where we sat down with the daughter. We asked the daughter if she would come in on a weekend basis to visit her mom and start cleaning out the apartment. Once again, as soon as the daughter left on the weekend, she had the whole week to order things, and things were coming in. So we're still working on that issue as we speak. She's getting a lot of the underlying issues addressed. She's still getting package delayed from her daughter, who was able to step in at a point and say, please, mom, let's stop this. But the pandemic has really changed the way that a lot of our seniors are now coming to grips with what's going on, especially with the social isolation and the lack of information, or the information that is coming to them that it is unclear to them. So we need to look into that when it comes to hoarding and when it comes to the pandemic. And you go to the next slide. I kind of touched on this before with the young lady. We went through a mental health assessment, a physical health assessment. That is something that has changed during the pandemic. Once again, a lot of our residents are not, a lot of your residents or clients are not able to get out due to the pandemic. So accessing those mental health assessments, getting them to their doctors, doing that telemedicine is something that we all need to focus on as one of the solutions to helping this underlying issue. Second thing is development of a positive and trusting relationship with the hoarder. One of the things that I pride myself on is making sure I know each and every one of the residents that I serve. Knowing when packages come, knowing when friends come, knowing when family come. So if there is an issue or becomes an issue, or I see packages being delivered daily, or if I see they're not having any family or friends being visited to them, then I become that positive and trusting relationship with that person. So if they do have a hoarding issue, that I can be the one to reach out to, and it can also be resolved. The third thing is providing treatment for underlying diagnosis. Again, reaching out when it comes to telemedicine and home care, making sure that each one of the social service agencies who come in are using precautions to work with the individuals as they come in. And last thing is working with family and friends to make those calls. Have them call in on the weekend, call on a daily basis. As our residents and as our clients sit there in their social isolation, it becomes very lonely. And when you're used to going out daily, when you're used to being able to go out and shop as a hoarder, when you're used to going out, you're going to the Goodwill, and you're used to going out to having someone take you, and that changes, that can be a very depressing moment. So making sure you work with your family and friends and make sure they do that constant contact with them on a daily and weekly basis to make sure we do that. You go to the next slide. But on a positive note, things have changed too with the pandemic. I had a hoarder, in this case, Mr. Parker. He was a hoarder. You could not get into his apartment. He was very reluctant at any time to change for his during the pandemic. We once had an aide come in, got aide service come in, help him clean it out. Within the next week, he was back in. So once with the social isolation came, Mr. Parker had to stay in his apartment, and he took advantage of that time. He took advantage of the isolation and restrictions and saw all the hoarding that was coming around him and all the clutter that was around him. It was almost like a gut reality check to him. So as he sat there, he went through a lot of the stuff that he had listed on a piece of paper that we had put together with him to try to get the things out. And he started to throw away some things. He started to put some things up. So his hoarding kind of didn't go away, but he took advantage of that time. So on a positive note, the pandemic can change a lot of our clients' outlook and a lot of our residents' outlook when it comes to hoarding. So the pandemic has changed a lot of things. That's my point of view from a resident service coordinator point of view. Not only is that as a community health worker, as I go out in the community and work with different clients and go to different people's apartments, just taking that extra precaution has changed during this pandemic, especially when it comes to hoarding. You don't want to pick up that much. You want to make sure your mask, make sure your gloves, you know, the elbow bump and things of that nature has really changed. The constant contact with individuals, just the touch of letting the hoarder know that you are around them and you're there with them has changed. So we have to change with the pandemic. But we all are doing it, and there are things we can do. And as you go through this conference and listen to others, you'll get different ideas on how to do that and how it has changed for the good and also for the negative. So because of time, I want to thank you guys for listening, and I will turn it over to the next panelist.
Thanks a lot, Darnell. I raised a couple questions. Hopefully I'll be able to get to ask those a little later. Maybe ran across some of the people's minds as well. So thank you once again. So our next speaker is Douglas Braun. Doug Braun is a behavioral health clinical social worker at Benjamin Rose Institute on Aging. In that role, he provides mental health, counseling, and case management. He has worked in the field of aging for 30 years and has presented various workshops on accessing services for families, caregivers, and care receivers. His areas of expertise include accessing community services and barriers to serving LGBTQ older adults. He received his master's degree from the Mandel School of Applied Social Sciences at Case Western Reserve University. So Douglas, you're on.
Okay, thank you, Larry, and thanks, Jean. I have been at Benjamin Rose for 30 years, as Larry said. Some of the different things we provide are, we serve people over 60 generally. We can go down to about 55 with certain mental health issues as well. We do counseling and case management, and also hoarding therapy, which is a type of case management that's based on cognitive behavioral therapy. Kirsten is also at Benjamin Rose, and I'll let her talk a little bit about her piece. Some of the stuff at Benjamin Rose that's changed with the pandemic is home visits. We actually stopped home visits for a while, then we went back to them. We could do 2 home visits a week instead of 15, which was our normal. The reason it was only 2 a week is because if we became infected, we didn't want to infect the whole caseload. We've done very well in keeping our people safe, the employees as well as the clients. Recently, with the uptake of COVID cases, we have stopped doing home visits, and that actually is kind of, it has thrown a big wrench into my work. I do a lot of the assessments for my own cases, and the assessment is where I actually try to make a connection with the person, and talking on the telephone doesn't let me see their body language. It doesn't let them see reassurance that they can see if I nod my head or smile. So that has affected the connection as far as my sense of things. We'll do case management over the phone, which isn't so bad because a lot of case management takes place over the phone anyways in calling resources. The hoarding therapy over the phone can be, it can work in some cases and it can be difficult in other cases. One of the difficulties I've had with doing things over the phone was the clients, communication happens differently in person than it does over the phone. I've noticed a couple people have had difficulty with the turn taking over the phone just because they can't see me. There's one client where I have to allow extra time because she doesn't seem to be able to process that it's her turn. She doesn't have any cognitive disabilities. It's just that that's how communication works with her. Let's see. I've had some luck. One client in particular has actually taken really well to the working over the phone. We'll talk about what her goal will be for the next week. And what she'll do is when she attacks her goal, she'll take pictures of the area that she's cleaned or cleared away. And she'll say, look, I threw all this stuff out. And she'll take pictures and send it to me via text. So with her, she actually can proceed pretty independently. And it sort of seems to give her a sense of pride. Look what I did. Other people, it doesn't really work so well for. One person in particular I'm thinking about, I mean, she's got overlying depression on top of everything else. And so I'll say on the phone, so how's this last week been? And she'll say, okay, which is pretty non-committal. And I'll say, what have you been able to work on? And she'll say, oh, I worked on the newspapers a little. And I'll say, okay, tell me what you did. Well, I threw out a bunch of newspapers. And I'm thinking, okay, how much is a bunch? Your perception and my perception are probably different. So I have her explain a little bit. And I know there are times when she just makes something up. She'll say, oh, it's about an inch worth of papers. And I know she might have done something, but I really, in her case, I don't really think she has been able to muster the energy to do anything because of the depression. So in her case, being over the phone really has harmed her progress. You know, Darnell talked a little bit about telehealth and some of the difficulties. If I have someone who's 85 years old and has poor eyesight, even if I give them a tablet, if they've never used a smartphone before, it's going to be difficult for them.
Hey, Doug, you're on mute.
Good Lord, how did that get muted?
I don't know.
Okay, did it just
okay.
happen?
We
Do I
got
have
you.
to go over the 20 minutes before?
Yeah, we missed the last 20 minutes, Doug.
Oh, don't worry. Don't
It
worry.
just happened about a minute.
Bottom line, some people respond really well to the over the phone. Some people don't. Some people I can set them up with the tablet. Some people I can't. We just do the best we can. And in some of these cases, it is more of an inspiration for us to reach out to family members who can actually assist in person. So with that, I'll let you go on with the next person.
Okay, sorry about that. I'm glad. Thanks a lot, Eileen, for bringing it up right off. I was getting ready to push. I was trying to unmute them from my end, and it just kept clicking mine. Thanks a lot, Doug. So next up we have, also from Benjamin Rose Institute on Aging, is Kirsten Yoder. So Kirsten Yoder is presently a behavioral health services day treatment group facilitator and social worker. She's worked in the field of social work for the past 15 to 20 years, providing a combination of social work, group therapy, case management, CPST, and outpatient therapy services for children, youth, families, couples, and older adults, where services were provided in homes, communities, schools, and office-based settings. Kirsten has been with Benjamin Rose Institute on Aging for 6 years. She is a State of Ohio Certified Mental Health First Aid Instructor, has presented on subjects including Mental Health 101, isolation and loneliness during the pandemic, depression versus the blues, and isolation and loneliness during the holidays. Very apropos at this time. She had an article published in New Directions on depression versus the blues. Kirsten has her undergraduate in sociology from Baldwin Wallace University and her master's from the Mandel School of Applied Social Sciences at Case Western Reserve University. So here is Kirsten for us.
Wow, thank you for that wonderful introduction, and thank you to everybody. It's a pleasure to be here today among so many wonderful people. And despite all my experience in the field and all the individuals I had worked with, hoarding has definitely been a whole new adventure and a whole new territory to work with, as many of you have known as you've done your own work and got to know your own clients. As you know, Larry had said, I work at Benjamin Rose Institute at Aging with my colleague Doug, who had just spoke, and he gave you a great rundown of most of our services already, so I don't want to repeat too much of what he said. Benjamin Rose, we do a lot of different stuff. We have our Center for Research and Development, which does a lot of research in the field of aging and has looked at that. Then, of course, we have our Elder Care Services Institute, which is a branch or subsidiary of Benjamin Rose, which of course has our mental health case management, our behavioral health services department, our mental health day treatment program, our social work department, which also Doug is of course involved with. And we did, let's see, mental health day treatment. We do a lot of different services, you know, we have our Margaret Wagner apartments also, which is operated by Benjamin Rose, which has its social worker there. So we do quite a bit in the field of aging. And again, our agency was one of the foremost for the hoarding program and the hoarding connection. And although we are without them at the moment, we had 2 individuals who were very involved through Benjamin Rose. And I believe at one time we had our Buried in Treasures kind of peer support groups as well that were run and led, which I heard were, you know, very wonderful. And I believe were very helpful at the time. So in particular, you kind of know from the other presenters, you know, kind of the rundown of kind of where we're going with stuff. At Benjamin Rose, I kind of do a dual role. I am a group facilitator for the day treatment groups. These are groups for severely mentally ill older adults that are 3 hours. Currently, we're offering them 4 days a week for adults, normally 60 and older. However, we do have some that are in their mid to upper 50s. And they are just various topics, anything from mental health to social skills, to attachment, to relationships, you name it, we kind of talk about it. One of the great things about it is it allows peers to connect to other peers. You know, it allows them to share their experience, their strengths, their hopes, their struggles. And the one thing I have found in working with, you know, the clients, you know, kind of in our program that we work with, is even though hoarding might be kind of the main concern, sometimes there's so many issues that underlie the hoarding. Whether it's obsessive compulsive disorder, whether it's anxiety, whether it's depression, whether it's attachment, right? You know, maybe they're holding on to stuff that was from a loved one who they just can't bear to let go with, you know, so maybe there's some grief and loss, or, you know, maybe they're holding on to something where, oh yeah, this person said they'd come back for it. I just can't bear to let it go because you know they're coming back, but you really know they're not coming back for it. They just maybe can't bear to part with it. Or it's something that I'll need, I'll use, I promise, I know I'm going to use this. So I find that the day treatment group can be helpful because, you know, we're also able to address some of those underlying, even if it's not the hoarding directly, you know, it's so complex, hoarding can be, as my colleagues on the panel have discussed, as well as you kind of heard from Doug as well, you know, kind of how complicated hoarding can be, as again, many of you have known from your own experience, as well as have heard probably throughout this conference, you know, all the wonderful, you know, kind of information that is to be shared with hoarding. And as Doug had also mentioned, you know, one of the things of our program that Benjamin Rose has been proud to offer is we treat clients where they're at, in the community, in their homes. Our day treatment group was able to meet in person, which was even better. You know, so we could decrease isolation. We could bring people face to face each other. Unfortunately, with the pandemic, we were basically told we needed to reconsider kind of in the moment, right? One day we were meeting face to face, everything was great. Then the next one was like, nope, you're done. Everybody stay at home, shelter in place. And as Doug had mentioned, that lifted for a little bit, right? For a couple minutes there, only to be kind of back down again. And I'm sure many of you went through that as well, maybe with your own agencies, in your own field, in your own line of work, have gone through the ups and downs, and maybe much like us, have been forced to look at a whole new way of delivering your services. So, you know, we were very lucky and we're able, with a great administrative team, to be able to find a way to offer telehealth, which is primarily over the telephone, as many of our clients aren't necessarily lucky enough to access video or have the technology to do a Zoom or a computer. As Doug had said, he had launched a wonderful program introducing some of our clients to technology and computers. Him and one of our other workers, Tahara Wilson, did a wonderful job kind of launching that program, bringing technology, and I think it went pretty well. Doug would be able to comment a little more on that. Should you guys have more questions, I'm sure he'd be more than able to talk a little further on that. So yeah, that has been a challenge, because where before, as I also help out with mental health assessments, I was able to see their house. I was able to see, but now I have to almost trust their word. And there's a couple hoarders that I've worked with where, oh yeah, I'm taking out a bag or two of trash. What's a bag or two? Are you talking about those little blue giant eagle bags? Or are you talking like a hefty bag, right? Those big 20-gallon garbage bags. Are you talking about those little garbage bags you put in a wastebasket that goes in a bedroom? Or are we talking like the Home Depot brown bags, right? That you can kind of take out. So that's kind of been a challenge as well. And, you know, keeping someone on the phone for 3 hours to do a group. I mean, talking on the phone is hard as it is, but for 3 hours, that's kind of tough. So we're very blessed. Our clients want the services. So we're blessed that we're able to do that. And again, so we're able to do a combination, but I think that's been the biggest challenge is, as Doug had mentioned, you know, normally a key thing to the hoarding is being able to engage, is being able to talk to them, form that personal connection so they can share those memories, they can share the attachments. And we're working with that over the phone, as again, I'm sure many of you are also experiencing, right? And having to figure out your own ways of connecting either with your clients or your building tenants, those who are supervising, you know, reaching out to your workers and doing all of that. One or two of the cases I would like to share is one, I was able to see her before the stay in shelter in place, the stay-at-home order came in, and we were sorting through a bunch of papers, and she still continues that. And what we do is we separate, you know, she tells me, okay, I have this in front of me. So we put it in 3 piles. What do you want to keep? What is a maybe pile? And what can you get rid of? And, you know, I give her the opportunity to kind of talk about that. And you probably would have heard some of that, I'm guessing maybe yesterday, maybe. I wasn't able to attend yesterday, unfortunately, about, kind of talking about, 3 separate piles, kind of something they really want to keep, stuff they can throw away. And then we have a maybe pile, which should, I'm hoping, with the vaccination now being available on the horizon, be able to get back out to the face-to-face. We can then look at if stuff comes in the mail, she'll read to me over the phone as best she can, the letters that are coming in the mail. Sometimes she'll mail the letters into me because I'm able to still sometimes go into the office to be able to pick up those. One, I am very fortunate and very blessed to be able to have a son who's able to take pictures on his phone of the letters and the mailings to kind of send into me. So we're able to maintain the social distancing. When we were, for a brief moment, able to go face-to-face, as Doug had mentioned, my colleague, when we were able to do that, we had on our gloves, we had on our masks, we had our clients sign waivers saying that they, they acknowledged that they were actively seeing us and it was at their own risk. We had hand sanitizer. We took nothing in with us. They had to wear a mask and they were also signing. And if they didn't agree to wear a mask, we didn't see them face to face. And our agency, had decided that it was safety above all else, safety for our clients, especially working with the vulnerable population that we are, as well as for our workers too, because we were going home to families and parents and children and grandchildren and cousins and all that. So it's been kind of really a roller coaster, that kind of has been up and down. One time the state's doing this, the next the county's doing that, and then it's this, and then it's that. So it's kind of really been able to think on your feet. And I'm sure I'm not telling you anything most people attending this conference haven't already heard of or been doing or doing there, and I think, this conference is great. It's a great way to share ideas for people to connect with each other. And, hopefully everybody can take a little something away from each other and, kind of grab. There's a lot of great resources out there. And sometimes I found what has been the most helpful is just to ask. If you don't know, just ask, because even if the person you ask doesn't know, chances are they know someone who does know, or if they don't know, that person can know. And that's kind of what I think is great about the Hoarding Connection, is if one person doesn't know, there's a whole network of people who do know, or at least maybe someone who knows a person who knows. So that's why, it's such a privilege and an honor. And I know I was talking a little fast. I had a little bit of coffee, but I also want to be aware of the time as well to allow our other panelists to share their experience and, their strength with everything, as well as allow time for, a discussion and questions as well. So thank you so much. It's been a pleasure and an honor to talk to you all. Good luck. And remember, you are not alone. Thank you.
Thank you, Kirsten. That was very good, very enlightening. So our next panelist is Lieutenant Mike Norman. So Lieutenant Mike Norman is currently the Public Information Officer for Cleveland's Fire Department. He joined the Cleveland Fire Department in 1997 and attended the IAFF Political Training Academy. Sounds pretty important, Lieutenant Norman. Norman is a 1993 graduate of Ohio University's E.W. Scripps School of Journalism. So without further ado, here's Lieutenant Norman.
Thanks, Larry, and thanks everyone for having me on the panel. I'm Lieutenant Mike Norman. I'm a 24-year veteran in the Cleveland Division of Fire. I work as a public information officer. I handle the media, social media, and I'm sort of the spokesman for the Cleveland Division of Fire. A lot of our mission doesn't really impact with hoarding. Our fire training academy, our inspectors, our dispatchers, and so forth. But really, our suppression personnel, the rigs that are rolling every day, doing both first responders and, of course, fire suppression, fire responses, they will interact with hoarding situations. And I really am impressed with the different clinicians and people who have been talking and so forth. It's really important work that you're doing. We don't necessarily deal with it so much on the psychological or mental side of it. We really deal with it more on the physical side and some of the challenges that presents for us. So from a fire perspective, of course, hoarding represents a larger fire load. That's more things in a house to burn. and a heavier load actually as we apply water and so forth. It makes it a more dangerous situation for our members to work in. It affects us for access and egress, but getting in and getting out. And so for access, that's both the fire side and the medical side. All Cleveland firefighters are emergency medical technicians. We're all trained at least to the level of EMT, and we have a number of paramedics as well. So while we don't transport any longer, we support Cleveland EMS, who handles the transport. So we will go in oftentimes on these calls where we're responding to these patients, and we will have trouble at times getting to them. And it can certainly be challenging removing them from their houses in the event that they need to be transported. Our mission hasn't really changed in the pandemic. It's certainly been challenging for the Division of Fire on a number of levels. We've had, staffing concerns with, we've had quite a bit of COVID on the Cleveland Division of Fire. We had one member, unfortunately, who died of COVID-19. So we take it seriously. We've been wearing our masks. Of course, when we're responding, we're in full PPE masks and gloves. And we've tried to abide by social distancing as best we can. Part of the culture of being a firefighter is living in the fire station. You almost live like a family, you eat meals together and so forth. So I've seen different places where fire stations will separate the tables, or they're sort of eating on different schedules. But, a lot of what we do, whether it's working out, just sleeping in the dorm at night, there are a lot of those things that put us in close proximity to each other, and we've tried to be more mindful of that. Also with sanitation, with hygiene, we have sprayers. We've actually converted some of our old masks to spray the sanitizer around the stations, and we're doing that on a daily basis. I'm just trying to protect ourselves because it's, we have a high level of exposure. So some of those things have been impacted certainly by the pandemic, and that's how things have changed for us. When we get on the scene someplace, if we're made aware of what we consider to be a hoarding situation, we're not certainly trained to do some of the analysis that some of the other panelists are, but we will generally refer them to the Department of Aging, and they provide the support from there. We've had a number of fires, especially. We had a couple of tricky rescues, and we had a fatal fire last year, actually in my neighborhood in West Park, where it just, it's the volume of the fire because of the hoarding and just the difficulty in both advancing hose lines and trying to get the victim out. Just they make for challenging situations on the fire ground. And firefighters, we always look at the structure. We're concerned with architecture. Every house we look at, we consider the challenges it would present if it were on fire. Firefighters will look at a house and figure out where the kitchen is or where the stairs are. Where anything is a point of egress for us, whether it's a window or doorway. And in a hoarding situation, those things don't make sense anymore. The typical flow pattern of the house, where we would think we would be able to go in, and certainly advancing a hose line. And then if you have something that's stacked very high and it falls down, it's a real challenge for us. It's a real danger. And we always message on just improper storage of things in general. People will have, even if they're not in a hoarding situation, they may use the attic stairs as storage, or they may they don't use a certain doorway anymore, so they'll stack things in front of it. And that's a concern for us, because coming from the outside, we just think it's a doorway. So those are some of the challenges that we've had in terms relating to hoarding and with the pandemic. And I think I covered it all. I kind of jumped all over my outline here a little bit, but I'll stick around, and if anybody's got any questions, I'd be happy to answer them.
No, that was very enlightening, very good. It's a lot of stuff that I hadn't even thought of myself. I think that'll generate some questions, but thank you very much. That was very eye-opening. I muted myself again. Sorry, I clicked the wrong button. Thanks a lot, Lieutenant. Our last presenter, but certainly not least, this was a last minute addition, and I'm glad she's able to join us, is Sergeant Rachel Rypinski. Sergeant Rachel Rypinski has been a paramedic with the City of Cleveland for almost 7.5 years. She's assisted as an education sergeant with training new cadets and providing continuing education for current employees. She is currently a sergeant in the field placement department working on continuing improvement. Rachel also wants us to know she has a husband, 4 kids between the 2 of them, 2 dogs, a Bengal kitten, and never a dull moment, as I'm sure she doesn't. So that being said, here is Rachel. Rachel, you able to join us? I know you were there before.
Okay.
Unmute yourself. There you go.
I did.
There
if
you
you
go.
can hear me.
Thanks. The
No
floor is yours.
problem. So good afternoon, everybody. Pretty sure it's self-explanatory what EMS does. Someone calls 911. Our dispatchers take the call, they prioritize it and send it out to the crews, and the crews that respond, they assess the situation, both the patient and what's going on, and they treat and they transport. As far as issues with the pandemic, just going off of what my colleague in fire said, because of the work that we do and the situations that we get put in, and with work schedules and everything else, we have had a high number of people exposed to the virus that have had to go on mandatory quarantine, and we've had a lot of sick call-offs, just because we don't want anybody coming in who is sick, and that puts an extra burden on the crews that are working because we're short-staffed. So that's a consideration for people. The other big thing that, as everybody else has been mentioning, our level of PPE that we have to wear. You know, we're required to, and it's changed, it's evolved as we learn more about the virus and what our administration determines is the best course of action. Currently, on all calls, we're supposed to wear 2 masks. We have an N95 on, and then we have a surgical mask covering over top of that. Depending on the nature of the call, we have to wear essentially a suit over our uniform to try and minimize any exposure of droplets getting on us and sticking. In a hoarding situation, one of the issues that can rise with that, with the extra PPE that we have to wear, during the non-pandemic, when we didn't have all of that on, it still took us longer to gain access to a patient because we had to find a path essentially to get to them. And now with all of the extra stuff that we're wearing, it makes it even more difficult for us to gain access and get to where we're going. And especially for someone like me, who I wear glasses as well. And now that it's colder, going in and out, my glasses fog up so quickly that having that mask on and making them fog up and stay fogged, that can become a visual problem. And when there's more stuff to try and work our way around, it just makes it more difficult. Some other pandemic policy changes, it involves our actual treatment of the patient, and we will kind of fall on different medication or treatment options and try like non-aerosolized medications before we jump to that. But the other thing that we're supposed to do is, in the event that there's a full arrest, we're supposed to work them on scene, which we should always be doing regardless, because in a full arrest, what we're doing on scene is no different than what they're getting in the hospital. So the quicker we can get all those interventions going in the house, the better it is for the patient, because time is critical, even more so in that situation. And having the ability to access the patient and have the room to do an airway and a line and medications, and being able to perform compressions and switch who's providing the compressions, because you're supposed to switch every 2 minutes, and having the room to work and provide the best level of care. And we're only supposed to transport in that situation if there's a potential COVID suspected. We're only supposed to transport if we get a return of spontaneous circulation. And so the chances of that happening in optimal cases, it's not high. And if we're having to delay being able to provide those interventions, the seconds count, and your chances, they diminish rapidly when we have to delay for whatever reason. The other issue with hoarding behavior in that scenario is the more difficult the extrication is, the more pauses we have to take. So the least amount of interruptions and compressions is what's going to give the best chance of survival to that patient. And if we have to delay extrication because we can't safely make it down the staircase, or we can't get the cot in to get the patient up and get them out the door, the more barriers there are, the more it impacts in a critical situation like that. On the flip side, when it's not critical and we're just trying to get them to go, the psychological underlayment of what's causing this behavior, it weighs more than reason, I guess is the best way to put it. So when we try and explain the reason behind what we're trying to advise them, because one of the big things I preach in my classes is that patient education is, while you may think that you're just there to provide treatment and transport, if we can educate our patients so that we're not called out the next time, or, you know, something serious or worse doesn't happen, if we can prevent things from getting worse, it's better. And when a person with hoarding behavior doesn't have a serious call, and we're like, hey, the next time when something bad does happen and we need to get you out of here quickly, this time that it's taking for us to clear your stairs or clear your path or do whatever we have to do, it's going to make a difference. And it just doesn't always click. And that it's frustrating because we want to be able to do more. And unlike when we call for kids, adults can make up their own mind as long as there's no other, you know, if they're alert and oriented, we can't force them to go. We can't force them to seek help, and we can just make the referrals that we do. And, you know, we tell all of our employees if they see something they're supposed to call. Even if it's on night shift and it's 2 o'clock in the morning, they're supposed to call 696 kids, and they'll transfer our referral over to the appropriate people who handle that situation. Another thing that I guess with the pandemic is that we get a lot more people who don't want to go to the hospital because they don't want to risk getting infected. And there's that fear of the future and just everything that's going on that, you know, I'm sure that's not helping the psychological issues that cause this behavior, but it also prevents them from seeking help for minor issues. I guess my final thought would be just looking back at hoarding houses, hoarding behaviors that I've seen. It's not just the materials that they collect, but it's all of the dust, and then you get animal feces and everything else that collects with it, and they're sitting in that, and now even more so, and the bacteria and the mold and the stuff that's growing in it, because it's just sitting on top of each other and collecting and growing and doing all of that stuff, it's going to wear on their immune systems. It's going to make them sick with other things that aren't a pandemic virus, but we all have heard in the news and just from our educations that we already have, that people with weakened immune systems, with bodies that are already fighting something else, this very bad virus that's going around right now, it's going to hit these people harder when they are exposed to it and they do get it, because their body's already exhausted from fighting something else. So if we can make those reports and get all of the other services involved, that, you know, you guys are doing your thing, and unfortunately we don't always get the follow-up on those patients, but prevention is key. So again, sorry, this was a last minute add-on, so I apologize if it's jumbled or not as clear as it could be. If there's any questions or clarification, just let me know. But that's about what I got.
Please understand it was not an add-on. That was very helpful, very informative. Thank you. Please stay with us on the video as well too, as we start going through the questions. I have lots of questions to ask, but I know there are some in here that are already in the chat room I'm going to start addressing. And please, if you have some questions that arose from what you heard from our panelists, please feel free to either add it to the chat, or if you want to speak up and you're brave to do that, you can do that as well. I wanted to bring this one up. I know that she answered one of the questions with some numbers in the chat room. You can check it out. So to APS, Natasha, when numerous referrals come in for the same person at different times for abuse or some allegation or self-neglect, how do you proceed when multiple referrals come in for the same person?
Well, every referral that we receive, we obviously put in the case record for an existing case. If it's a case that happens to be closed and we have a different allegation coming in, or there's more evidence of something going on, we may reopen the case in APS. But well, it was April of 2019 when we began using it consistently, but the state went to an APS statewide database. I think I referenced it earlier when I spoke, called the Ohio Database for Adult Protective Services. And that captures every case that does come in on that particular individual. So we do keep track of those. They get attached to open existing cases. They may lead to a reopen. The interesting thing, though, about often getting different reports from different individuals is that when we do have a case that is extremely sticky and we need a lot of evidence, maybe in order to bring forth to court to request like a protective service order, to request for a formal evaluation if a client is not ready or willing to do that on their own accord, or, you know, when we have guardianship hearings, more is often better. Obviously, guardianship is the most restrictive kind of arrangement that could happen with an older adult. So we want to be very certain that when we do stuff like that, we have everything we need as far as documentation to show why a decision maker would benefit that older individual. So it's not uncommon for us to get multiple reports on one case. There could be some variations in that report. At times they are very spot on and very consistent with maybe what somebody else is alleging is occurring in a particular situation with an older adult.
Great, thanks. So this is probably directed toward Douglas or Kirsten. How does somebody participate in a Buried in Treasures workshop?
Well, I actually haven't, I have some clients who've gone through the program. I don't have a direct connection myself. I would suggest calling Benjamin Rose at their number 216-791-8000 or going to our website. I know that there are some workshops around Ohio, and during the presentations I saw someone mention that there were some virtual presentations being offered. I'm afraid I don't know details about that stuff.
There was a client I had worked with who actually, and of course I couldn't share her information, but from what she had shared, it was a peer-led group that she actually led some of the peer-led groups because she had graduated from the program. We had 2 key staff members who are part of the Hoarding Connection. So even if you maybe went on the Hoarding Connection, the website, the Cuyahoga County Hoarding Connection, there may be links to maybe that. And I don't know, maybe Buried in Treasures, and Doug, please refresh my memory. Would that maybe, Jean Hoban has clicked on. She might be aware or know of some of this as,
Jean, I have this.
well. Huh?
I have this, Jean. I know she's jumping on.
Oh,
but
okay.
wanted to
I'll
give,
let you handle it,
Please,
Larry.
yeah, like I said, I've indirectly heard about it. I know it was a program that was very strong with Benjamin Rose, and I think a lot of our clients benefited from it. So I might defer to either Larry or Jean to maybe help field this a little further. Doug, thank you for taking this one.
Go ahead, Jean. Go ahead, Jean.
Okay. Yeah, the Hoarding Connection has led several workshops over the past few years, the Buried in Treasures groups. During the pandemic, we put those on hold, the face-to-face groups, but we are in the process of developing the back end for presenting the groups virtually, where we're still trying to work out the logistics of that. I've been working with one of our regular facilitators who has led several of the groups for us over the last few years to figure out which pieces of the Buried in Treasures manual, the facilitator's guide, need to be amended. Not a lot, or she didn't believe so, and I'm trusting her judgment because she's been leading the groups and she's also a teacher who's been teaching remotely throughout the pandemic. So if you refer people to the Hoarding Connection website, as Kirsten mentioned, there is a form where people can express interest in being notified when a group starts in their area. They are, when face-to-face groups are only in Cuyahoga County. When people inquire from outside of Cuyahoga County or from outside the state of Ohio, I do usually try to link them up with their local hoarding task force, as there is one, or some universities I've noticed across the country sometimes offer hoarding workshops in their communities.
Thank you very much, Jean, for clarifying that. So Lieutenant Norman, there's a question for you. If you could, you mentioned in your presentation proper storage guidelines for paper. Could you say a little bit more about the proper storage requirements for paper storage?
I don't really know. I don't have any like specific guidelines for storage of paper. I think that anytime flammable products like that are left out, they become a bigger fire hazard. Somebody else asked a question about whether or not that a hoarding situation makes a house more prone to a fire. I would say that it would. You have things like space heaters, candles, frayed electrical cords, some of our common culprits for accidental fires, especially house fires. And if you have very flammable materials, certainly that paper load is going to not only have a higher incident of a fire starting, but a quicker fire spread. You know, there's just more there to burn.
Okay, thank you. So Melissa asks too if the hoarding connection works with the suburbs in regarding to hoarding, particularly the paramedics and the fire department. I'll sort of answer that. There's always an open invitation for anyone from any of those types of agencies and safety personnel to come and join us. I know that we had a consistent presence from Rocky River's fire chief, Robert Crow, who was part of us and benefited and shared a lot of information concerning fire safety and issues around hoarding. But once again, this is not something that we necessarily have a common. Lots of our fire personnel and EMS are very busy, and they have a hard time getting people to commit to come to such gatherings to sort of share some of this information. But we're more than willing to come and talk on the issues around hoarding and such, and what to maybe do when you come across that in your times and in your calls. Darnell, I had a question for you. I was, when listening to you, two things popped up. When you talked about pandemic shopping, that was very interesting. That I'm sure that's very noticeable in your facility. I did have a question of how do you said that you try to build a positive relationship when you're dealing with your residents. How do you build a positive relationship when your message is usually always seen as negative, because it's basically you need to address this issue and clean up your apartment?
Well, we try to use motivational interviewing, things of that nature. We try to show them the good versus the bad. We make sure that they know that we're not out to harm them, but we're there to help them. And as many of the panelists have stated, we state the facts. Even though that may be hard to believe, we state the facts of what could happen if this was to happen. If a firefighter was to come into your home, this could happen. If you was a fall, you could be a fall risk. So we show them the positive inside of the negative at the same time, but also be that supportive ear that they listen to.
Okay, great, thanks. And yeah, of course, you back to also to that pandemic shopping. Are you seeing some people who are now all of a sudden shoppers and they're getting lots of stuff more so than prior to the pandemic, or is this just the normal course of events and people are just ordering more stuff?
Well, one of the things that I get is isolation, with they hear so much information but not be able to go outside and be able to see what's really going on. They see the store shelves on the TV filled with no tissue, so here you have someone who has tissue, and I can't leave out, I can't go anywhere, but the TV shows there's no tissue, here it is. Or you hear the report that all the hand sanitizer is going, you have a neighbor who says, I have this big bottle of hand sanitizer. There's none out there. Well, I'll pay, if you pay $20, because there's none out there. So those type of things. And like you said, when it comes to shopping online, that when you have those residents who do have access to technology, all those things are popping out at you at that one time. And here they are. You can't leave out, so let us bring it to you. So those are the things.
So I don't see many trips to Sam's Club and Costco's at your facility.
No, just the commercials popping up on their phone so they can click, click, click.
Okay, thanks a lot. So from Wendy Hunter, she has a question for either the lieutenant or sergeant. When you receive a call and a person is identified, prior to the call or prior to making the call that you have a hoarding situation. Are there differences in preparation before getting to the home? And are there usually questions used during the initial call to identify hoarding issues?
Well, I don't believe that our dispatchers would ask about hoarding. That just wouldn't be sort of part of the medical call protocols. Now, there may be notes for a specific address that would indicate that it's a hoarding house, just as we do for if there's a hazmat in a certain business, or bed bugs and certain things that we deal with. If we become aware of it, that'll go in the notes on our computer-aided dispatching, so that the responding crews will be aware of it. And then a lot of we get to know the neighborhoods that we serve, especially if you've worked in the district for a while. You'll know the houses that are of a concern for that. So some of that's sort of our own innate knowledge, and some of it would be in the notes, but it's not something that we're asking people, you know, question 14 isn't, are you a hoarder? You know, something like that.
Mhm. What about you, Rachel? You're muted.
There we go. I unmuted myself.
It's okay.
I was just going to second what the lieutenant said. It's not something that comes up with the dispatching questions, and in all my time picking up on the truck, I've never seen it come on the CAD that it's a hoarding situation. It's generally one of those things that you walk into and surprise.
Wow.
I don't really think we do anything differently as far as what we prepare ourselves with, because we're going to have the standard PPE on for every call, just because you never know what you're walking into and you never know what the patient situation is going to be, and you just always want to be protecting yourself. That's the first thing we learn in basic school way back in the day, is your safety is the primary thing. So we're always going to take those precautions. Just reiterating what's been said, it's more going to be an issue of us getting them out at that point. It's not so much getting in, it's getting out.
Okay, that's good. That's good. Thank you. So Diane asked in the chat room, does anyone know of online support groups for a family of hoarders? For the family of hoarders? And there are a lot of answers in the chat room. I appreciate people who responded, Ann Zanin and Dana Carmen, but also too, this is our time to sort of promote the Hoarding Connection website, which is hoardingconnectioncc.org. Hoarding Connection CC stands for Cuyahoga County.org. We're very proud of the fact if you do a Google search on Hoarding Connection, we're the first thing that pops up, so you can always do that. But I know there's some references and some links to some support groups, I believe, that are listed in there that are referenced and mentioned by the people in the chat room as well. So I thank you very much for that. Let's see here. So we have that from that, excuse me. Here we go. So this is a question for Doug. Do you utilize, this is from Michelle, do you utilize a modified form of CBT with your clients, cognitive behavioral therapy? Besides picking one area to declutter, what other homework have you seen to be effective?
Actually, yes, it is hoarding therapy does involve some CBT techniques. Basically, I need to figure out what is motivating the client to want to declutter. If there's no motivation, there's really nothing I can do. But I can sometimes sometimes the client will say something like, I really wish I could get to the family pictures. And if that's something she expresses, then that's something we're going to work on. So trying to find out what interests the client. I mean, I had another client who she was willing to do absolutely anything because her landlord, basically she was hiding her hoarding from her landlord, and all of a sudden he found out and she felt terrible. So with her, it was easy to identify something that she wanted to attack. So identifying what they want, what they're interested in, also trying to look at what is holding them back. Does she have a strong, do they have a strong emotional attachment to something? One of my clients saved absolutely every newspaper because she had to look through the obituaries. And so we did some exploration, like why she had to look through the obituaries of every single newspaper that was ever published. So if you can try to figure out what motivates them, that's where I would try to focus the attention and the homework.
Great, thank you. Michelle had a second part to that question too. I'll address this to Kirsten. If the client has no supports in place, how do you work with the client to get items sorted if they're not physically able to do it themselves?
That is a very good question, and actually one I am facing with a client right now, who, well, again, because I haven't been able to do the face-to-face, is I've tried to look into what support she might have with her family, as sometimes the family's been in the same, I know the term that's been used during the pandemic is the bubble, right? Kind of those who have been in their immediate bubble. Tried to see if there's a way for them to come into her help, or maybe they've been interacting with a neighbor in their apartment building, or maybe a social service coordinator who's been checking in, or maybe been able to, yeah, Darnell smiling over there. You know what I mean? Who's been able to been in contact with them. You know, trying to just find maybe somebody who's in their, you know, who's in their environment. Sometimes, you know, the landlords are awesome. They kind of know people around who can help. If there's a really good relationship sometimes with the maintenance staff, you know, sometimes they're able to do some heavy lifting. So I think it's really sometimes for me, just exploring outside of the box, right? You know, because in my case with the lady I'm working with, her sons are like, you know, we've been dealing with this for years, right? With our mom hoarding and doing all this. We feel awful, but, you know, we've got families to think of with our own kids. You know, we've helped her clean out 5 or 6 or 7 times already. Now we're doing it again. So it's really been trying to explore, okay, is there a social service consultant? Is there a neighbor? You know, could maintenance help her lift with the boxes? If she were to at least get the trash bags, is there a dolly she could even use? You know, to kind of get the stuff out to the trash bag if it's hard for her to lift? Or, you know, could we, like, is there a little shovel she could push? I had one person use a broom because she was at least able to sweep, you know, kind of the stuff. And, you know, somebody was able to do that. So the best thing I can say is think outside the box. You might have to be creative and really look to see what other supports might be in the building where they're at, because you might be surprised and find that one person. So again, talking with the landlord, talking with the social service consultation, social service coordinator, I believe that's what they're called. And you can do that over the phone, you know, and that's why I think too, it's establishing a relationship with those people in the buildings. Identify who your key people are in these buildings, and really try. A lot of the senior apartment buildings, they have great, you know, resources in them. It's just a matter of figuring out who they are and maybe talking with them and getting that partnership established. Especially since we do need to resist, you know, we do need to honor social distancing and where our clients are with that comfort level, as well as the apartment buildings themselves, where they are with their expectations. So hopefully that answered the question okay.
Yeah, that was very good.
Larry, I have another suggestion about the homework.
Sure, go ahead, Doug.
A lot of times I'll find someone, when I try to identify homework, someone will try to say something that to me seems really, really like too much. And what I'll try to do, like someone 2 weeks ago, she said, I want to clean off the couch and clean the floor off in the living room and vacuum it. And I said, okay, that's a lot of stuff. What's the most important thing? And we settled on cleaning the couch off. Oh, but I want to vacuum too. And I said, okay, what are you going to have to do before you vacuum? I'm going to have to clean off the floor. Okay, well, let's just keep it simple. One thing. And so I'll sometimes have to talk them down to just one thing. That's it.
Mm-hmm. That's good. You have to become a pseudo professional organizer. I know we have some of those people on our involved in our conference today. And, you have to wear many hats, that's for sure. Lieutenant Norman, Eileen has a question for you. I was curious if you've ever been involved with animal hoarding cases. And to your knowledge, what sort of response is constructed for those type of cases? And then they also are asking what type of supports are available, but I don't expect you to know that, but have you run across any animal hoarding situations, Lieutenant?
I think that we have. That wasn't something that we're really trained for. So a lot of times an incident commander, an officer on the scene will call in another resource from the city that may go to animal control, or somebody else who's got more training in those specific sorts of situations. You know, we wind up on on the scene sometimes with pets who have lost their owner. You know, well, the owner's deceased, but you don't think about that. We usually think about the pets passing away, but certainly we try to be aware of those things and help those animals in any way that we can.
I'll just share this, that through the years we've had conferences specifically on animal hoarding, and it's a tough one. There's not a lot of research on it, and it's a different type of animal. Sorry for the pun, but it's a tough one there. And check our hoarding, once again, the Hoarding Connections CC website, and I believe there's some links to some assistance for those type of subjects as well. Let me see here. Besides CBT and buried in treasures, what other resources can a social worker go to seek help for clients with hoarding behaviors, and if another state other than Ohio and California? So there is some answers to that. Ashley, by the way, presented that question. There has to be a component. I'll answer this very briefly. There has to be a component of some type of counseling. If you were part of any of the other two conferences on Monday or Tuesday, it's very clear that if your plan is just to go in and clean out a person's house, that's not going to solve the problem. That hasn't changed the behavior, and it hasn't changed the feelings and the thoughts and the decision-making processes that person's going through. So there has to be some sort of counseling involved with that. So let me see here. Doug, I had a question for you. You were talking about electronic devices for the clients you were dealing with because of the COVID stuff. This is your chance to be a positive Yelp viewer or reviewer. Any ideas on what tech devices you're finding are easiest for a client to understand to use?
Well, a lot of people are used to using their smartphones to look up, like one client looks up her horoscope information, looks up stuff on Young and the Restless. So for her, a tablet was a real good next step, because her smartphone was just so big, and the tablet allows her to see things better. When in that project where we're doing the telehealth and providing tablets to people, what I've done is we've installed things before giving them to the tablet to the person. Things like Google Duo, which will help them do face-to-face with their family and friends. A couple of relaxation apps, different things like that. So if you can pre-program I think tablets are pretty easy. Or if they're already using a computer for downloading sewing patterns, tie into that. But the tablets seem to be pretty easy, and if you can pre-program or download some stuff ahead of time, that's usually helpful.
Mm-hmm. Mm-hmm. Good, thank you. Hey, this is from Diane. Does anyone have issues? Does anyone have issues with the senior hoarder getting huge amounts of mail or catalogs that are so heavy? I know of a woman who has her mail brought to her in assisted living, and she does not trust the mail in her box, and a friend delivers it daily. It overwhelms her and she can't get through it. Darnell, that might be up your avenue there.
Yeah, well, she needs to talk to that friend about delivering the catalog, because she's part of the problem as well. So yes, we do have residents who receive a lot of mail, especially when it comes to catalog. What I try to do with those is they bring them to my office. I have to bring them to my office so I can share them with other residents. I white out, cross out their names or take the things out, but I turn it once again into a positive. Why don't you share this magazine with someone who is isolating? You don't need it. You may not need it. Just bring it to my office. So we do have a library inside of our facility, but we do have a magazine exchange, especially with this isolation piece, with them not being able to get accurate information or getting real information. Sharing those catalogs and sharing those magazines is a great thing to do. But don't share the magazines with the hoarders, because the hoarders will use that magazine and order a lot of stuff out of there. But also need to talk to the friend too, to make sure, you know, the friend encourages the lady not to have those many magazines and catalogs.
It's almost a blessing that there's no longer a Montgomery Ward or JCPenney catalog anymore. Isn't that correct? Thanks. You know, this is a little off the subject of hoarding, but I had to ask Lieutenant Mike Norman, because Rachel mentioned this or hinted at this. What happens to a station if someone gets the virus? Because you guys are so close knit, and you said you're like a family. That's had to have happened.
Yeah, we've had a number of cases. So it's kind of evolved. You know, initially they were bringing companies in to spray the stations. That got to be cost prohibitive as we've come into the fall. We've certainly seen an increase in the number. So we just try to, you know, be as preventive as we can in terms of our social distancing. And then you just deal with it. We've had companies where maybe one whole shift will either be COVID positive or there'll be, you know, high risk exposures, and we're still working as long as we're not symptomatic. We're doing temperature checks every day. There are a lot of, you know, things that have become just sort of part of our daily routine. Like I mentioned, the cleaning of the fire stations and so forth. But, you know, we handle it the way we do any vacancy, and our suppression staff will either hire overtime, or if, you know, we have 4 firefighters in every company. So if one company has 5 scheduled for a day, they may send one of their firefighters over to another company to fill in. But we make sure we've got 4 firefighters on every apparatus every day, and we're still responding. We're still coming. We saw in the beginning of the pandemic, we saw a real sharp decrease in the number of runs, actually, which is interesting. I think that people were very concerned about not going to the hospital. But our run volume is back up, and we just kind of adapt and overcome as best we can. But we're still responding every day. We haven't closed a company or anything. We've been lucky that way.
That's good. That's good. Natasha, I haven't forgotten you. I wanted to ask you, have you been getting resistance from clients? We always get resistance from clients in APS coming to see them, but are you seeing an increase in people not wanting to see us because they're afraid of the virus?
I think initially we did. And I think, you know, that was one of the excuses that was being used when we were trying our initial unannounced visit. The social worker would show up, they'd answer the door or talk through a window or something, and that, you know, basically would tell the social worker they weren't welcome because they were fearful of getting COVID. So we had to be a little bit more creative, kind of utilize still at that point in time, you know, trying to meet outdoors, through the door. The problem is you really need to see the home environment with many APS cases. So we try to finagle our way into the home. Our workers, we've been fortunate enough to have had PPE on hand here. We have a part of Senior and Adult Services is a home support program. And so we had masks and gowns and some of the things that I think made people feel more comfortable. And the county did a very aggressive initiative to try and collect more PPE, to the point that, you know, my APS workers, as you know, Larry, our staff, do have some extra masks with them that they do take out on visits to kind of reassure somebody if they don't have a mask, we could provide them with one. I think in the summer, things improved slightly. Our numbers seem to have plateaued, and then we're dropping. And right now we're heading into the, you know, winter months. There's also fear about and concern about flu and other things going on. So I haven't heard too much pushback from our workers, but you have to remember a lot of cases are adult protective services cases because these are seniors who aren't very mobile. They're often seniors who could be isolated to begin with. They are people who might not be getting out and about. So I think that I'm more concerned about our staff bringing something to our seniors than us actually going into environments where those seniors live. Again, I'm just waiting for some of this to really get a true control over. I think once that happens and there is some normalcy that comes back to our daily lives, that when these cases start to come in, we're going to see the effects of people who have not been receiving medical attention, who have not been interacting with others, who have discontinued services that before they participated in, whether it's a hoarder or somebody else who was receiving home health aid services. I know that that also puts people at a tremendous risk. A lot of times when the pandemic started, there were agencies, home health care agencies, that pulled out altogether. They weren't sending in aides to go see clients who really required personal care. They required meal making, assistance getting in and out of bathtubs, things that often we take for granted. And that created a huge issue, because then you put somebody at risk for, neglect. It may seem unintentional, but it was occurring. And then